Chris Rustin. I'm the Director of Environmental Health for the Georgia Department of Public Health. Today we're going to have a call, obviously, with the community in Waycross to discuss our health consultation activities. And I thought that we would start first with an introduction of the agencies that are on the call and then introductions from the community. And I want to also point out that the call is also being recorded. So again, I'm Dr. Chris Rustin. I'm the Director of Environmental Health for the Georgia Department of Public Health.
I'm Jane Perry, the Director of the Chemical Hazards Program.
Hi, I'm Dr. Sherry Drenzik. I'm the State Epidemiologist here in Georgia.
Hi, I'm Frank Sanchez. I work with the Chemical Hazards Program with Jane Perry.
Sean Ryan, I'm the Director of Communications at DPH.
And do we have anybody from EPD on the call?
This is Bert Langley.
Okay. And ATSDR?
This is Sven Rodenbeck. I'm the petition coordinator for ATSDR.
Okay, my name's James Thomas.
Is it community?
Hello?
Is there anyone from the City of Waycross ESG operations?
Yes, Larry
Okay, I think that's all the agencies that are participating on the call. If I would like to ask everybody to please mute their phones. If you're on a cell phone, to please mute. There's a lot of background noise.
What's the number to mute? Can anybody tell me what the number is to mute?
Try *6. Okay, we still have someone unmuted. There's a significant background noise.
I ain't gonna talk over the phone. Just forget it.
Okay, there we go. Okay, again, this is Dr. Rustin with the Department of Public Health. I thought that we would kind of start the way we got this agenda laid out. It's in no specific order, but we thought we would allow each agency an opportunity to talk a little bit about the activities that's happened down in the Waycross community. And also, I wanted to have the community introduce themselves. Could the community members on the call please introduce themselves so we know who the members are?
Chris, I'm having trouble hearing you.
Okay, someone has a phone that's not muted.
Hang on.
Thank you.
Okay, thank you. Okay, I just wanted to turn it over and let the community introduce themselves.
I'm James Piper.
I'm James Thomas.
I'm Janet McMahon. Bonnie Gaskins.
Henry Bussey.
Peggy Adams.
Lenny Siegel, calling in from California.
Rebecca Roeder. This is Dr. Yolanda White.
Is that everyone from the community that wants to introduce themselves? Is there anyone else from any agency on the call that wants to introduce themselves?
This is Rachel Nolan.
Dwayne Butler.
Okay, what we're going to do now is I was going to turn this over to Jane Perry. She's going to talk a little bit about the health consultation activities, and once she provides some information, we certainly will take questions from the community.
Hello, this is Jane. I know most of you on the call. Thanks for calling in today. We received a list of questions and information from Joan this morning, and thank you for that. We will review all of that information. That's exactly the kind of information we need to conduct health consultations. So we'll be reviewing that and addressing every item on the list you submitted. There also was a question this morning about our timeline for conducting this health consultation, and at the community meeting in July of 2014, I talked about doing it in the fall of 2015, and yes, we are behind on that timeline. We don't have deadlines, we just set goals at the time. I personally wasn't aware that this site has been regulated for decades and that there are just literally thousands and thousands of pages of data and information. So over the last year or so, as many of you know, we did conduct 2 health consultations for the 7 Out site, and since then, as we work around the state on our other sites, we started gearing up to complete the health consultation for the CSX site. Some of the activities that are involved are pretty extensive and take quite a bit of time. And this is a list of what we are currently doing. We're summarizing the regulatory history from the CSX rail yard from both state and federal agency files. We're conducting literature searches for this specific site and for similar sites and industries in other states. We're reviewing reports, photos, data, medical tests, survey data, concerns submitted by residents, working with county and district health departments, cities, counties, state and federal agencies, elected official and other local leaders, business sector, the community groups, and others to gather additional health, safety, and environmental concerns and information. We're evaluating all available existing environmental sampling data. That includes soil, sediment, water, air, and food samples for the types of chemicals and extent of chemical contamination. And then we're beginning our toxicological evaluation of completed and potential exposure pathways to determine whether exposure at levels of health concerns has occurred, is occurring, or might occur in the future. We'll summarize cancer incidence data and analyze available health outcome data for non-cancer symptoms and diseases. As many of you know, we also work with ATSDR, and since this site was petitioned, we've been working to help with the petition process by providing the information that we have gathered so far. So that petition process is underway, and up to this time, we would just continue to work on all of these activities and provide a health consultation as soon as possible. Now, as you saw on the agenda, there are 5 different specific areas that we have gathered concerns about from the community, and in no specific order, we'd like to address some of your outstanding concerns at this time. As I mentioned before, all of the questions that were submitted to us in writing this morning, we have not had a chance to go through and address all those specifically, but we will. So if you have any specific questions you'd like to ask us, anybody from ATSDR, EPA, or Department of Health, I guess we'll open it up for questions at this time.
You said, this is Jane Piper. You said you are gathering existing data, or you're doing more data collection on sampling in the area, environmental sampling, and looking at, like animals and stuff like that.
We're evaluating first we have to gather all available data, and then we'll evaluate all the available and existing data. A health consultation may result in recommendations for additional environmental sampling. But to do that, we need to evaluate all the data that exists.
So, Jane, we were hoping this was going to be finished in the spring. I mean, and we have 12 cancer cases this year from children. How much longer is this evaluation process going to take before we have some, some more recommendations? Because we're going to stop this based on what's already happened in the existing testing.
Well, the cancer data analysis goes on concurrently because that is important information, and as with last year in 2013, the first Waycross cancer cluster analysis report was released to the community before any health consultation. So we work closely with our cancer section to evaluate cancer data and cancer cluster requests as you all submit them, and we do have an update on cancer data analysis results. Sherry?
Okay.
Sorry, go ahead.
So have you decided that this is a cluster? You confirmed that?
Hello, everyone. My name is Dr. Sherry Drenzek, and I am the head of the epidemiology program here at the Georgia Department of Public Health. I'm also the state epidemiologist. I wanted to just take a couple of minutes to, again, highlight some information about the cancer cluster investigation procedure and the preliminary results of, again, this investigation from the epidemiologic perspective. So, again, as you all are well aware, I'm sure a cancer cluster has a specific definition that CDC uses and other agencies use. And again, it's defined as a greater than expected number of cancer cases that occurs within a group of people in a geographic area or over a certain period of time. So for us in epidemiology, the way that we systematically go about assessing a cancer cluster, and in order to do it accurately, we basically must go ahead and verify and characterize each of those components in that definition. So to begin with, we always look at, are the reported cancer cases indeed verified? Are they real cancer cases? What type of cancer are we talking about? Is there only one type involved? Are there several types involved? What ages are affected? What is the geographic distribution of these cases? And what time frame are we talking about as well? Ultimately, what is the population at risk for these types of cancers? So, in order to do this, it is indeed not something that we just make up. There is a very specific standardized procedure in which increasingly specific information is obtained and then analyzed in stages in order to make decisions about what we do next. This procedure is a 4-step procedure overall. It was developed by CDC and also the Council of State and Territorial Epidemiologists and was published in September 2013. Again, this was a revision of the previous cancer cluster investigation protocol from 2000. So ultimately, we follow this very standardized, systematic approach outlined by CDC guidelines, and it essentially gives us this information. The very first step is, just as I mentioned, to characterize that who, what, when, and where. And once we characterize that, it becomes important for us to define that most important step, which is this greater than the expected number that we see? So we compare the observed number of cases to what we expect. And we have to use existing surveillance data and surveillance trends in these areas over time to point us in that direction. And another important piece to look at when we're doing a cancer cluster investigation is indeed to look at what are the scientifically known risk factors or exposures that are associated with the cancer types in the cluster. This is based on a review of literature, and it's very important. As you know, cancer, different types of cancer have a variety of causes, and some of them are known to be environmental, some of them are known to be genetic, some of them are known to be both. So we have to look at that for biologic and scientific plausibility. Is it possible that the reported group of cancer cases was indeed caused by a common exposure? So we have to look at the literature to point us in that direction as well. So all of these data that I just talked about, the who, what, when, where, all of this comprises essentially the first two steps of our standardized procedure. The data characterization and then the determination as to whether this indeed is more than we usually expect. Those are the first two steps, and we use that information to decide whether further investigation epidemiologically then is warranted to try to further elucidate risk factors. So let me tell you a little bit about what we found preliminarily in these first two steps of the cancer cluster investigation. So we had recently, our investigation comprised looking at 4 recently reported cancer cases in children in southeast Georgia. 4 were reported to us. We indeed were able to verify all 4 of them as being real cancer cases. 3 of them actually were actually seen in the Florida healthcare system for care. 1 here in Georgia, and 1 was in our existing cancer registry data. One thing to mention just very briefly about cancer registry and cancer registry data. Although cancer is reportable in Georgia, again, it's reportable within a period of time, again, that can extend anywhere from 6 months to even up to 18 months to get information in registries. So often, very recently reported cancer cases are not found in our registry. We were able to find 1 of these cases in our registry. We found the other 3 being seen from information from Florida healthcare facilities. And here's what we found out about these 4 recent cases. They were actually 4 different kinds of cancer. 1 was a bone cancer, and there were 3 different types of soft tissue sarcomas. So there were different kinds of cancer, all 4 of them. The various ages, again, extended from 2 years to 14 years. The residences were in 2 different counties in southeast Georgia, Ware and Pierce, and they were not geographically clustered close together. And then also, when I mentioned that it's very important that we look at whether we know of any kind of known causes from the environment for these types of cancer, none of these 4 cancers have known environmental causes. It's very important to think about as far as plausibility of an environmental exposure here. Now let's answer the next question, which is,
on the 3 of those cases were rhabdomyosarcomas, correct?
No. Two of them were 2 different types of rhabdomyosarcoma. One was the other one was a fibrosarcoma.
Can I ask a question?
Okay. Wait just 1 second, James. But they're all sarcomas, correct?
3 of them are sarcomas.
You're saying
1 is a bone sarcoma, 1 is a fibrosarcoma of the brain, and then there are 2 rhabdomyosarcomas.
Okay. And so the rhabdomyosarcomas, they are, all of those sarcomas, though, are within a geographical region if you consider air and not just water, correct?
The 2 types of rhabdomyosarcomas actually have different cellular origins, so they're different types of cancer. If you don't mind, let me take just 1 more minute, and then we can answer the rest of the questions, just to tell you a little bit about how we also determine whether we think of these 4 as being more than we usually expect. So we actually just compare it to, cancer data, looking at not only the expected sort of incidence that we see in either of these counties alone, either Ware or Pierce, or even in southeast Georgia as a whole, like the 16 counties that comprise what we call our southeast health district. So in any case, when we look at these rates, and this is the second step of the investigation, the overall cancer incidence, again, in Ware is lower than the state as a whole. In Pierce County is the same as the state as a whole. And when we look at these counties individually, over the last decade, at least from 2003 to 2012, which is the most recent cancer data available, in Ware County there were 14 cases of childhood cancer that were reported of all types, and in Pierce there were 11. So again, about 1 to 2 a year. Some years we would have 3 cases in one county and 0 the next year. So again, it's not, again, kind of above what we normally expect to see. Although the soft tissue sarcomas that we talked about previously are indeed rarer childhood cancers, we do expect to see about 35 cases a year of those types of sarcomas in Georgia overall. And when we look at the just kind of overall childhood cancer rate in the 16 counties that comprise our health district, again, this rate is lower than the state as a whole. So again, when we look at this information, put it all together, I know I covered this very quickly in a very brief way, the 4 different types of cancer, not geographically clustered, various ages. None of these 4 cancers have known environmental causes, and then it's not. There's no evidence, at least preliminarily, that have evidence that this is beyond what we expect.
Sherry,
based on this current.
Rabdomyosarcomas do have environmental causes. Just because you don't know that the chemical is present, or you haven't studied the chemical present, there are causes for these rabdomyosarcomas. And also for you, environmental. Pardon me?
And they are environmental. Benzoate, which has been found in Waycross, causes different sarcomas. If you study the NIH study where environmental benzoate causes sarcomas, fibrosarcomas, which you said one of them is, rhabdomyosarcomas, which 2 of them are, polymorph cell sarcomas. The benzoate does cause sarcomas. Benzoate has been found in the environment in Waycross. All 4 of those children have sarcomas. All 4 were diagnosed within 58 days.
And also, and other things that cause it are dioxins, which we have a presence of, and pesticides and herbicides.
Dr. Geller of Poison Control said we definitely have cancer clusters here.
Well, what about the lymphomias that they've known about since 2013, that we have a 300% higher case rate, and yet they've known about it since 2013, and then you add that with the sarcomas, and yet you're saying that we don't have a cancer cluster?
And also you're saying that these, the national statistics says that we should have 100 and something like 69 per million, which in our region, that means that we should have 2.45 cancers per year in our area. We have 9, we had 9 plus 2 more, so we have 11 this year. How can you say that we don't have an uptick? That's a 500% increase.
All right, that's a lot of numbers and a lot of data that you're telling us. So I think that in the interest of time, we need to continue this cancer cluster discussion. Sherry just talked about the first 2 steps in a 4-step procedure, so we are certainly prepared to continue with this. All of your concerns and comments that you just expressed have all been recorded as far as the specific chemicals of concerns and questions. And again, the information you provided this morning about with information about potential upticks and increase in cancer rates in your area we'll all continue with that discussion. But in the interest of time, I wanted to talk a little bit about non-cancer symptoms and diseases. And as many of you know, we've been looking at those too, and there's been a lot of survey data from the Silent Disaster Group surveys that we've looked at. We'd still like to get more information from those surveys if we could, so that we could analyze the data a little more accurately, and we can pass that request back on to you again. Also, as far as symptoms and diseases, we're planning a activity where we're going to contact the physicians and other healthcare providers in Ware County, do outreach, and set up a line of communication with all of them so that they can report to us any trends, any symptoms, diseases, concerns that they have. So we're also evaluating all of our OASIS data, which includes emergency room and hospital discharge data, so that we can see what people are going and getting care for. So I wanted to mention that the non-cancer symptoms and disease analysis continues. Please continue also to send me your, this is Jane, to send me your any data, any information about people who have symptoms and diseases.
Excuse me just a second. I got to go back to this cancer. I am sorry. I don't understand how we can provide you with 4 cases of sarcoma in 58 days, and you can come up here to this meeting and tell us that we don't have a problem.
Well, for one thing, they weren't.
Wait a minute. Let me finish, please. And now you want to move on to us providing you more data? We need to find out what is causing these cancers in these children.
Well,
this is escalating.
Well, we did look at the cancers, and they are not 4 cases of sarcomas in 58 days. One of those cases was in our registry, meaning it had been diagnosed a year or more ago. One of them is not a sarcoma, but a bone cancer. Children do get cancer, unfortunately. It's a terrible thing, but we are looking at these. So that leaves 2 cases of sarcoma that we looked at. So even
if you look at sarcoma in 2 cases, we should not have, under the sarcoma areas, we should not have more than 1 in a 10-year period.
You need to talk to these parents. We have their telephone numbers. They have their past reports. Please call and talk to the parents and look at the past reports. Do not depend on the CDC registry, as it is flawed. They take the zip code of where the patient resides, or the zip code where the patient might pick up his mail, which could be 2 cities away, or the zip code where the patient was diagnosed, or the zip code where the patient received their first chemo treatment. In my son's case, it was New York City. I live in South Georgia. You cannot count on the CDC registry. It is flawed. You need to call these 4 children's parents, get the past report, see when they were diagnosed. They were diagnosed within 58 days. They are sarcomas. Sarcomas can be caused by benzoate-pyrene. Benzoate-pyrene was found in the environment in Waycross.
Ms. Terry, I have a question to ask you, too. You did a slide presentation here in Waycross, and at that time, you already, on your slide presentation, said that we had a much higher case of childhood lymphoma. What have you done since 2013 about that? What kind of testing's been done or anything since we have that much higher rate of lymphoma along with these sarcomas?
We have updated the cancer analysis data to include 2 years since that analysis was conducted, and we will provide the results of the lymphoma update and other sarcoma information to use the community soon.
How much longer will it take for the ASTDR to accept our petition?
This is Dr. Rustin. I believe ATSDR is on the call, and they can speak to the petition process.
And what about testing? I mean, why hasn't testing been done? You've known about the lymphomas since 2013, and benzopyrene has been found, 2-3 years ago.
Let's start with, that's two questions, so let's start with the first one. ATSDR, would you care to discuss the petition process?
Certainly, this is Sven Rodenbeck. We're still analyzing the information and data regarding the petition. We, of course, have received over the last couple of months some additional information from the citizens, so that has required us to take a look at that information also. I'm hoping now in about a month's time we should have a decision.
Okay, in 1 month, 2 more kids could be diagnosed with sarcomas. My husband and I have been pleading with the health department to warn people in South Georgia to test their water since February of 2010, when we found arsenic and lead in our deep well water after our 2 Labradors, my son and I, were diagnosed with cancer. At the same time, 4 small children just 7 miles north of us were diagnosed with cancer. All of our cancer patients were also finding arsenic and or lead in their drinking water. We ask that the health department please warn people to test their water for arsenic and or lead and get a water filter if need be. The health department has only warned people one time in March of 2013 to test their water. They warned over radio, TV, and the newspaper. There are many, many, many babies that are drinking arsenic formula plus benzoate formula.
Ms. McMahon, this is Dr. Rustin. I want to make a couple of corrections. The Department of Public Health has worked very closely with the South Georgia medical community. We've actually put out information 2 years in a row on arsenic in groundwater, the naturally occurring arsenic that's been found down there. We've done numerous interviews, we've done reports with the media, we've also added links to our website, the one thing that we've done, numerously is we've advised the public in South Georgia that if you're on private drinking water, if you are concerned about your water quality, to test your water and provide those results, and we can certainly provide education on that. So I just wanted to clarify some of the information that you're providing, because we have proactively provided information to the South Georgia community.
You proactively provided this information in your extension offices?
We send out, we made county-specific fact sheets of all of the results of arsenic testing that have been done in 8 counties in South Georgia. Currently, we're updating that to include all the counties of South Georgia below the gnat line. We've also sent out those fact sheets to all the medical, veterinary, public health, cooperative extension agents in the county. Also, we conducted a health consultation and published that and made that available to the public. But we continue to every year repeat the arsenic education. It is very important that people test their water and test it for arsenic and other chemicals.
Speaking of testing the water, let me ask a question to ESG and to EPD. Are we testing the city's water for PAHs, which include the benzene pyrene?
Hey, this is Larry with ESG. We have tested the city's water for PAHs.
For PAHs?
That's correct. And those results were provided at a commission meeting back in 2013. They're non-detectable, and that's using drinking water standards, which are tremendously lower values and detection limits than most standards would apply. We're also so low on SOCs and VOCs and other volatile organic contaminants that they're non-detect. So these things are not present in the city's deep well system.
And who's doing those? Do y'all do those testing in-house, or do y'all contract that out?
The state of Georgia, EPD Labs, does that testing and analysis.
So you send your stuff to them, or do they come down and test it?
No, they send bottles. We collect the samples and we send it to the EPD lab.
Okay, can you provide the community with that data?
Yeah, that data is available to the community at any time they want it.
Okay. Can we also get the wellhead data? You tested the wellhead before treatment, correct?
Yeah, the wellhead data is the same as the finished water data. There's really no difference. It's groundwater systems wellhead data is the same as finished water data.
So you're not treating it at all? You don't add anything to our water or treat it in any way prior to?
We chlorinate it to disinfect it. And
so then it's not the same.
Yeah, it is the same. There's nothing. There's no chemicals added that would affect PAHs or any type of volatile chemicals in groundwater, not in Waycross.
I have a question. My name is James Thomas, and I'm fixing to get very technical here. There's orange stuff now showing up in the canal when you go around it, your lips burn. And I live about a half block from Alpha Street Canal, and I live about 6 blocks from CSX Railroad. And before we moved over here, my wife had no brain tumor, none whatsoever. My wife does not have a history of brain tumors. My wife, when she was a child, had no diagnosis of brain tumors. My wife had epileptic seizures. I can tell you right now what she was born with. She had multiple holes in the heart, which they fixed when she was at 13. She had no palate to her mouth. They fixed that when she was 13. She had a hole in her spine when she was 13. All her life, she had seizures. When we moved over here in 1992, everything was going good. My wife was outgoing. We would go to church, doing our grocery shopping, paying our bills. And in 2001, my wife was diagnosed with a big, long-neck tumor. They took it out in 2001. Last year, again, they took a tumor out of my wife's head again.
JT, I have the pictures that you sent me. This is Jane with the orange runoff, and I'm aware of your wife's cancer diagnosis, and we do have all that information.
Back up. Both times they were benign. My wife never had a brain tumor until we moved over here on Crawford Street. Now, my other question, I'll let you answer in a minute, is why did a person at the EPA admit to me on the phone that it would take multiple lifetimes for CSX Railroad and Atlanta Gas to clean up their contaminations? Those are the two questions I wanted to ask. Thank you for your time.
This is Dr. Quebeca. Can I just intervene on the time constraint that I have with just a couple comments?
Yes, please.
Okay, this is Dr. Anna Quebeca. I'm a physician that has been here in Southeast Georgia as a public health servant initially from the National Health Service Corps since 1999. Prior to that, I did work with the Naval Medical Research Institute and research, et cetera. One thing I noticed in my patient population in doing organic acid testing, a toxicity marker called methylhipurate. So with CDC evaluating the cancer rate to look at this marker that is known to affect the immune systems and is much higher in our region than on a national level. This lab worked with Laboratory Metametrics Lab, looking at urinary organic acids, which is now Genova Lab. and they can pull the data based on zip codes. So I'd request the CDC to pull that information, look at the urine toxicity markers, and especially the marker of methylhydrurate, which is a product of off-gassing. So why would it be higher in our region? I've worked with clients in Ware County, Blaine County, Kingsland, et cetera, for, since 1999, and have noted a significant increase over time of severe hormone disruptor, symptoms of hormone disruption within my patient population base. So there's also a request, too, to please pull Florida data for the cancer registry, since most of our clients go to Florida, and looking at maybe there's a skew why your numbers are lower, but we do lose, a lot of our clients will go to Mayo or other Florida hospitals and get treatment here in Southeast Georgia. So I request that you please pull the Florida cancer registry system, and also not only look at the cancer places diagnosed, but also pulling our clients who are having cancer as far as where were their mother and father raised, because often the etiology comes from being raised in Ware County, where they may be now in Duluth County or somewhere else. So looking very distinctly for those lineages back to Ware County, and then the adult cancers as those are being looked at in addition to childhood cancers.
Ma'am?
And unfortunately, I have to go, but I definitely wanted to make my input as a physician here in Southeast Georgia.
You messed up on. You messed up on two things.
Thank you, Dr. Quebec. We appreciate you joining us.
Yes, you're welcome. Thank you.
Hi, this is Dr. Yolanda White. I'm another pediatrician. Hello. I would like to also give input. My name is Dr. Yolanda White. I'm a pediatrician. Hello, am I allowed to speak?
Yes, please.
Go ahead.
Go ahead, Dr. White.
Yes.
My name is James Thomas. My wife's first surgery was in Jacksonville, Florida. The second one will not show up on Florida Register. It will show up in Atlanta, Georgia.
Thank you.
Thank you, Mr. Thomas.
Go ahead, Dr. White.
Yes, I just want to express to the government officials, I really do appreciate you guys making this time available for this call to help this community who has reached out to me to assist them because their needs are not being addressed. I'm very concerned that about the discrepancy between their testing and your testing because we really do need that consistency to establish that trust. And also, the fact that we have 4 different cancers does not mean that these are totally unrelated, because even when you take into account child physiology, we all know that children's organs are all developing at different stages, at different critical stages of development as they grow and mature. So the wide age ranges and the different types of cancers really should not make that much of a difference. And also, even if you look on the American Cancer Society's website, the information for rhabdomyosarcoma, they admit that we're really not sure as to all the different causes of rhabdomyosarcoma. So therefore, taking into account the precautionary principle, where even if you suggest, you don't even need proof, but just the suspicion or the index of suspicion that an environmental toxin is linked to a cancer, that warrants further action. Thank you.
Thank you.
This is Representative Jason Spencer. Is Dr. Sherry still on the line?
Yes, I am.
You said that one of the cancers that in these 4 cases we discussed was a bone cancer. Can you define that bone cancer in that particular case?
Normally, we try not to give too specific of information because of confidentiality, but
Ma'am, I understand HIPAA. I'm a healthcare provider, but if we're going to talk about the types of cancer in these cases,
it's a Ewing sarcoma.
Okay, so it's a sarcoma. Okay, so it is a sarcoma. That's what you're telling me.
Yes, it's Ewing sarcoma.
Okay, that's what I needed to know. That's what I needed to know. Thank you.
And my husband, Dr. Howard McMahon, would like to know how the public is being warned to test water. We have not seen those warnings for the public. Our patients still are only hearing this from our office.
We'll continue to provide information about arsenic and other well contamination with Cooperative Extension and with EPD. We'll go ahead and do another round of blanket outreach to Ware County. We have not traditionally conducted that in Ware County because it lies outside of the Gulf Trough region. But we do intend to include all of South Georgia counties because everybody should test their well for chemicals every 3 years, whether or not they're in the Gulf Trough, which leads to higher incidence for arsenic in water.
Ms. Terry?
Yes.
What about the other sources that has had recent violations, such as Georgia Biomass and GATX? What about, will their data be considered, and how hard could it be for our community and our public officials to provide studies for the blood and urine for people that are at risk, and to make their testing to not be at the levels of an industrial testing level, but make people that are in their homes every day and drinking the water, breathing the air. We really need someone that will completely monitor the air that these factories and stuff are putting out, as well as the groundwater contamination. And just as that other doctor, he brought to our attention just now that even though we were just now being told that we only had 3 sarcomas, but yet he confirmed that the bone cancer patient was also a sarcoma, correct?
Yes.
Ewing's sarcoma, excuse me. Well, then that makes 4 sarcomas, correct?
Exactly.
Okay, you've asked.
Okay, why are you trying? I mean, I get the impression that it's being belittled here by using technical terms when there were 4 sarcomas. We already had 300% higher cases of childhood lymphoma, so that in itself is an alarming amount. Then we have the 4 sarcomas, and yet we're being told that it is not a cancer cluster. I mean, can anyone explain, why we're being led to believe that it was not a sarcoma, and then being led to believe we don't have a cancer cluster when in 2013 we were already told we had 300% higher cases of childhood lymphoma in this county, Ware County?
So although these are all 4 sarcomas, and certainly we are continuing to look into this, although they are sarcomas, in general, their specific origins are very different. They are different kinds of cancers. So again, as far as the data we have for these 4, again, this does not meet that definition. However, again, we are interested in hearing about other cases that you have mentioned as well, and maybe ones that may have been recently diagnosed that we don't have in our registry, so that we can indeed continue to look into this.
Will you accept the past reports from Joan Tiber?
What past reports are you referring to?
The 4 children who have sarcomas. Their parents want something done.
That is how we've received the information, was from Ms. Tybord, the 4 cases you're referring to. So if you've got information on cases that we may not be aware about or that are not in our registry, we certainly would like for you to provide that information to us.
Okay, I have a specific question for you. Can you tell me, please, Ms. Sherry, how many rhabdomyosarcomas we should have for our area? Since you've already done this and you've decided that we shouldn't have, that we don't have too many, how many should we have for our area specifically?
No, so
we have.
So
I'm
actually,
tell you how many children we have. We have 13,152 children in our area. So how many rhabdomyosarcomas should we have?
No, we don't. We don't have the information to that level of the specific rhabdomyosarcoma.
Well, then what do you have? Because we don't want to leave this call without having some answers. And we want to all be on the same page. So I want to know where you're coming up with your data and how many rhabdomyosarcomas should we have for our area or whether,
Cancer registry
how are
is
you
what we're
trying to
getting
figure
at.
this?
So we, all cancer data here in Georgia comes from the Georgia Cancer Registry.
This is Rebecca Roeder, and if I could just make a comment. Obviously, public health is a retrospective study, and I think in the meantime, the community is very concerned about the safety of drinking their water. Is it potable? Showering in it, and how safe their air is to breathe. So what will it take to have the Department of Health or EPA come in and do an in vitro toxic assay on some of the water sources that residents are concerned about, and for some type of continuous emissions monitoring of the air? And I also want to note, I apologize, I forget the gentleman who spoke from the water company. It's important to realize that you don't have to have high levels of some chemicals for them to have significant impacts on human health. They're called endocrine disruptors. So low levels of organics is not necessarily something to write off as not being a health problem.
We're running out of time. This needs to be the end of it.
I ask one more question, and then I'll be quiet. My name is
I realize that, but the levels of non-detection levels is what we're dealing with. I wanted to make it clear while I'm speaking as well that the Waycross water system has been erroneously connected to the shallow water well systems and the private water well systems that exist around Ware County. The Waycross water system is on a deep well system, 715 feet or further below grade. So it has been extensively tested for many, many years. Everything that EPD requires to be tested, EPA and EPD, these are award-winning facilities. They are not a source of contaminations, and specifically for these PAHs that exist, they're not water soluble. So I wanted to kind of make sure that stays clear that the city's water is not the water that the concerned citizens that are talking about the shallow water, the arsenic, those types of things, the private wells. That is not connected to the city of Waycross in any way.
Well, I think, Larry, that the problem came in because we asked that the city test for PAHs, and we were told that they would not test. You told us that y'all weren't going to test, or they told us one. And so there has been, if we're going to, we know that we have a problem in our area, so we need to know if you're testing, we need to know you tested, and we need to see that data. And I think that will help clear everything up.
No, as far as I know, the interaction was we did test specifically for this. What we said was we're not required by EPD to test for these. This is not something that EPD normally requests a groundwater system to test for. But we did have the analysis run, and they were non-detects on those parameters. So, and those were reported.
I think most water systems do test for PAHs. This city actually got a variance so that they don't have to test. Now we're concerned because, obviously we're concerned because one of those wellheads, or two of those wellheads, the city and a county wellhead, our well is very close to the CSX property. So it's not, I'm glad y'all tested. I'm glad y'all took that step, but please provide that data to us.
Yeah, we have provided the data. The data is available through the Freedom of Information Act, and none of our wellheads are close to the CSX property that I'm aware of.
Isn't one well downtown by the city water department?
Close to we do not have all of the wells that the city's water system is comprised of are located at one location on Alice Street. There's no other well. That's what's important to make sure we keep with the understanding that these are deep water wells, and they've been extensively tested by all EPA and EPD standards, and we don't have detection on these parameters.
So, Larry, are you saying that you won't provide us with a copy of that without a FOIA request?
That is not what I said.
Okay,
That doesn't say that at all. I actually said that has been provided. That information was provided at a community commission meeting, and I have that information available. It's available through the offices of EPD in Brunswick at any time.
Can you pull it up on the website? Because I'm looking now.
We need to wrap up this call because some people have some prior commitments, but I'd like to suggest that we periodically have these calls. I think today we started the discussion on the cancer, and we will continue to look into those data. And we also discussed a lot about city water contamination, so I think it's been a productive call. There's a lot of questions out there, a lot of concerns, and I think we need more time to go through all of this information together.
This is information that the NIEHS, the people that do the cancer cluster studies for the government, that needs to get to the public health department, the ATDS or the Georgia EPD. The lady at NIEHS told my husband, a physician, Dr. Howard McMahon, that they have known since the 80s that there is enough arsenic in the water here to cause cancer clusters, but they are not allowed to warn anyone. I would like to ask Jane Terry, when you say you want to do a blanket, are you talking about newspaper, radio, and TV so the public will see it?
Yes, we can do some media communications, absolutely. Thank you, Janet, for that information too, and we'll continue this on future calls. Please keep in touch, send me information, continue to email with me, and if you want any other specific questions answered, please don't hesitate to contact me.
Ms. Terry, one final question I need to ask, because it seems to me that we've been going back and forth since 2013, and we have not seen any continual monitoring of this area, and we haven't seen anything really being done to protect citizens in Ware County and Pierce County from these contaminants. And we can talk all day, but there needs to be some monitoring, some continual air testing, continual water and soil testing.
Well, those are questions for the Georgia Environmental Protection Division that we'll need to capture on another call, or you're welcome to continue to send me that information. In the email Joan sent this morning, all of that was outlined, and it was sent to EPD also. So I'm sure they'll be able to spend some time addressing those questions over the near future. Thank you.
Also, should I send the NIH study that says benzoate in the environment causes many different sarcomas, such as fibrosarcoma, rhabdomyosarcoma, and polymorph cell sarcoma?
Yes, please. Anybody can send me any information you would like me to have. Just email me all the information you'd like us to look at, please.
Okay. You do the information when you get it.
Thank you all for calling in. We certainly appreciate the information, and we'll definitely keep these calls continuing to provide information to you all at the public. Thank you again.
They're giving us all the information.
There we go. That's a good button to hit.
EPD didn't answer.